How's day shift been? Does it look like it's going to be pretty busy on second shift?
It's been pretty busy, but nothing unbearable.
Okay.
Right now in room 221, there is a patient who's 16-year-old female who presented to the ED this morning complaining of fatigue. Her mother's in there currently, and she said she's been very irritable, experiencing headaches, and noticed that the patient has been very pale. Patient's temp is stable at 97.6 orally. Blood pressure is 105/68.
97.6, that's kind of low.
Yeah. But it's been a stable 97.6 since this morning.
Okay.
A heart rate of 56, respiratory rate of 13, and pain on 2 out of 10 on the numeric scale.
What's her pain from?
From her head. She has a headache.
Okay.
And I would definitely recommend drawing a CBC with differential and a pregnancy test on her.
Me too.
Yeah.
Thanks. Have a great day.
Thanks.
Hi.
Hi,
I'm Heather. I'm going to be your nurse today.
I'm Molly.
Nice to meet you, Molly. What's your name?
Edmina.
Edmina, can you state your full name and date of birth?
Edmina Smith. 16. Where does that? January 3rd, 2000.
Seem a little confused about your birthday.
My mom usually takes care of those things.
She's tired. She's been so tired and fatigued.
You've been pretty tired.
And she's so pale. Don't you see how ghostly she is?
My head hurts.
Your head hurts. Okay. What would you say on a scale of 1 to 10 your pain is right now for your headache?
Probably about a 2.
2. Okay.
She's just so pale. And
Yeah.
she doesn't eat anything.
Sure. When was the last time you had a bowel movement?
A couple days ago.
A couple days ago. And what do you eat a lot of fiber in
She
your
doesn't
diet?
eat anything. How can she have a bowel movement?
I like pickles and chips.
That's all she eats.
Okay, so why don't you eat anything other than pickles and chips?
That's all I really like.
Look at how
Okay.
frail she is.
Yeah, she looks very frail. Looks like you're not feeling so well.
Oh, my head hurts.
I'm gonna take a listen to your lung and heart sounds, okay?
Okay.
And her nails are so brittle.
Her nails are very brittle.
She's just lost so much weight.
Can you sit up for me at all?
Sure.
Are you okay?
I'm okay.
You're not dizzy?
Deep breath.
I don't think it's her lungs. She's just so pale
Yeah.
and fatigued. I'm just so worried about her.
Good. You can go ahead and lay back. Since you haven't had a bowel movement in a couple days, I'm gonna go ahead and listen to your stomach too, okay?
Okay.
She spends so much time with that boyfriend, she forgets to even eat.
Everything sounds really good. So I heard your mom say that you lost some weight.
Yep.
How much weight have you lost?
About 10 pounds.
Okay, and how long did it take you to lose those 10 pounds?
It was kind of a while that she lost the weight. Oh, another thing that I wanted to tell you, and I keep forgetting, she used to have very, very heavy periods. Very heavy. Past 2 months, she hasn't had any.
Okay. Did you change anything in your activity levels? Are you running a lot or exercising a lot?
No.
No.
She doesn't
okay.
do any exercise. She's just with that boyfriend and on the phone.
Okay, and how long have you been with your boyfriend?
J-Rock? A couple months.
A couple months.
Yeah.
Okay. And do you want me to ask your mom to step out before I ask you some more personal questions?
We're very close.
We are very close.
Oh, okay. So, Anmina, have you been sexually active at all?
Yes.
Oh, I can't.
And
Oh my goodness.
do you use any form of birth control?
How could she? I've never taken her to buy any.
None at all.
Oh my goodness.
Not condoms or anything like that.
Nothing.
Oh my
Okay.
goodness. Angelina.
Okay.
Oh my goodness.
So I think what we'll do is we'll go ahead and get a hold of the doctor right now, okay, and let her know what's going on. It's Dr. Stone today. I'll let her know you're feeling pretty tired, you got a headache, and that you are feeling a little bit weak, and that you haven't had a period for a couple months, okay? And we'll go from there.
And we're just gonna wait?
You're gonna have to wait for a little bit, okay? I'll be back soon.
Okay.
There's no more of that J-Rock.
Dr. Stone,
Hi,
how's it going?
busy day like always.
Okay, well, I'll make this quick. I have a 16-year-old female in room 221 who's here. She's presenting with fatigue and irritability. She's got a headache. She hasn't had a period in 2 months.
Okay.
She is sexually active and does not use any birth control.
Oh boy.
Yep. And her mom's in the room. She's very concerned. And her temperature's kind of low. It's 97.6. So I let her know, her mom and her, that you would come in and take a look.
Okay.
All right,
Sounds
thanks.
good.
Hi.
Hi, I'm Dr.
you? What's your name?
Anemia.
Okay, I heard you weren't feeling so good today.
No, my head hurts.
Your head
And
hurts.
she's pale and fatigued.
I can see, yeah, she looks a little pale.
And she's
Are you
been so
sleepy?
irritable.
Just regular.
Okay, I'm gonna listen to your heart and lungs real quick.
See how frail she is?
Maybe you sit up, please. Deep breaths. Okay. Well, that all sounds good. Anything else that's changed recently? I heard you lost some weight.
Yeah, a few pounds.
Yeah, and you're not trying to lose weight?
No.
She doesn't eat anything. Her diet
Okay.
consists of nothing. Pickles and chips.
Okay, well, I'm gonna get some labs drawn.
She hasn't had a period in 2 months.
Okay, we'll get it figured out. I'm gonna get some labs
And it was
drawn.
really heavy before.
Okay, let me talk to Amina, okay? All right, so I'm gonna get some labs drawn for you. There's a few different things I think could be wrong with you, but we'll get it figured out. So I will talk to Heather, and then the lab tech will come in to draw your blood.
Okay.
Thank you, Dr. Stone.
You know, I think she might have some type of anemia, but I'm not 100% sure. I would like you to get a pregnancy test for me, as well as a CBC with differential, CMP, TIBC, as well as a ferritin level. Once those come back, I will look at the levels and we can talk.
Okay, thanks.
Mm-hmm.
Oh my god, hi Admina!
Hi.
Wait, that's your name, right?
Right.
Okay, can you tell me your full name and date of birth then?
Edmina Smith, January 6, 2000.
Coolness, that's totally what matches on your wire. Okay, can I see this arm? I'm gonna draw some blood labs. I'm just gonna like get this area. Also, I super love your tattoo. Was that from like some rebellious phase, or are you just like cool like that?
J-Rock, my boyfriend, likes it.
Oh, did you get like a matching one with him?
We do.
That's so romantic. Oh my gosh. I love it. Okay, I'm gonna put on some gloves before I forget because it's like rules we have here. So I heard your mom's like totally overbearing.
Yeah, that's my mom.
My mom's like that too. I really hate clothes. Okay. So you look pretty pale to me.
Yeah, my head hurts.
Yeah? Okay, well I'll tell your nurse that your head hurts, but really, you should consider getting some like fake tanner or at least some toner because your face is real pale.
Okay.
Okay, cool. Well, I'm gonna go get your lab test results now, so I hope you feel better.
Thanks.
Labs are in! Hemoglobin, 9 grams per deciliter. Hematocrit, 32%. TIBC, 375 micrograms per deciliter. Ferritin, 75 nanograms per milliliter. Pregnancy, congratulations!
Mom, I need to get some toner.
Why? Because you're so pale?
Yeah.
Oh, we'll get you some toner. You gotta be feeling better.
Okay.
We'll get you something.
Thanks, Mom.
Hi, Adamina.
Hi.
So we got your test results back, and they were all decreased, except the TIBC was increased. That's indicative of anemia. You know what kind of anemia she has. Also, you're pregnant.
J-Rock's gonna be with me forever.
Well, that's one way to look at it. All right. Well, I'm going to let Heather take care of you. I gave her some real specific things to do and go over with you, so you're in great hands.
Thanks.
Okay.
Are we supposed to come back to see you, Dr. Stone?
2 weeks.
Okay.
2 weeks.
Okay.
Okay.
Okay, so now that you know the results of the lab tests, that you do show a form of anemia, that you are pregnant. So I've got some things that we can work on together and we'll get you through the pregnancy together, okay? So my nursing diagnosis for you is imbalanced nutrition, less than body requirements related to a pregnant state as evidenced by fatigue, decreased hemoglobin, and weight loss. So basically what I would like you guys to do and the doctor would like you to do is weigh yourself daily so you can keep a good track of how much weight you're either gaining or losing. And if you start losing a ton of weight again, go ahead and come on back in. The doctor has also prescribed you a prenatal vitamin. You need to take that every day for your baby.
Can I still eat my pickles?
You can have them in moderation. I'll talk to you about your diet. But the multivitamin or the prenatal vitamin you should take with food because it could make you kind of nauseous.
And I'd like your diet, or the doctor would kind of like your diet to be increased in meat, eggs, and cheese. So if you're having a craving for pickles, by
Have
all
some
means,
cheese with it, maybe?
you could have some cheese with
Oh, you
it.
can have pickles wrapped in meat.
Pickles wrapped in meat. Sounds delicious.
And the doctor would like to do some frequent lab monitoring to keep track of your anemia, because if you continue to be anemic, the baby can be anemic, and that's an issue. So we really want to make sure we correct this before we affect your baby. So it's really important to take care of yourself. Don't skip any meals, even if you're not feeling up to eating. And the doctor wants you to return for lab work in 2 weeks.
Okay.
Okay.
Are we free to go? Did we discharge them?
Yeah. Do you have any questions, Edmina?
No questions.
I hope you start feeling better.